Do something different this year and kind of mix it up. We're going to first talk about pediatric risks and injuries in motor vehicle accidents. We're going to talk a little bit about motorcycles, and then we're actually going to kind of, since we're in the South, we're going to parlay that into talking about football actually. And the reason why I'm going to use football is as a relative comparison to the risks involved with playing football, comparing that to a teenager driving an automobile. And also along the way, we're going to talk about perception, because right now in society we have a certain perception of the dangers of football. And of course, when you're in trial and you're presenting facts, that's very important, right? But what's the most important thing? It's the perception of the jury, not what reality or truth is, but it's what they perceive to be reality and truth. So we're going to go ahead and use that. Then also we're going to kind of get into, if we have time, a little bit of diagnostics, just some important information to glean from a doctor's record for accident cases and things of that nature. So let's get started here. Pediatric motor vehicle safety. All right, accidental injury is the leading cause of death among children. Motor vehicle accidents account for 40 to 50% of all deaths among children. 1 in less than 50 kids born in the United States will die in an accident before the age of 25, while 1 in 20 will be seriously injured. That's a lot of kids. That's a lot of kids. More than 5,000 teens die annually in accidents, and over 350,000 are treated in emergency rooms. Motor vehicle death rate amongst male drivers and passengers aged 15 to 19 are almost twice that of girls. Go figure, huh? And we know that teen drivers are 4 times more likely than older drivers to get in an accident. Okay? So, I mean, you know, things that we kind of already know, right? But it's interesting to actually look at the numbers and look at what the figures show. Okay. More than 50% of children are killed in car accidents are unrestrained. So now we're going to start talking about what can we do about this here. Okay, do we need to raise the driver's license age limit? You know, I mean, do we need to do that? I mean, that would actually save lives. It would. Is it practical? Is it fair? You know, that's not for me to debate. But there are things that we can do. And of course, we're going to talk about how children are supposed to be restrained. Child safety seats have been shown to be about 70% effective in reducing fatalities amongst infants and more than 50% in toddlers. Now, my oldest son, who's now in college, I vividly remember when he was going to Houston Academy, and we'd be sitting in that car lane, and you'd see these mothers flying up, you know, in their SUVs. Now, you got to understand, I mean, you would like to think that this is an educated group of people that, you know, come from a certain cut of cloth, and yet time after time I'm seeing these mothers fly up there with little kids in the front seat. They just flew off the road and pulled in there. They're just bouncing around the front seat. Now, do they not know any better that you don't allow a child? We're going to talk about you don't allow a young child in the front seat, period, much less not restrained, right? Do these parents not know any better? But of course, we've got this society now where we want to not be confrontational with the children or upset them or be bothered because we're on our cell phones, we're on our Facebook. We ain't got time to deal with that, right? But kids are dying as a result of this. They die. They get crippled, okay, because we don't take the time to think about what the heck we're doing. Well, we got them in dance class. All right, so obviously little kids got to be in a car seat. Then from 4 to 7, you know, they got to be in booster seats. But again, height is a big key. Got to be over 4'9" before you get them into a seat belt, and we're going to talk a little bit about that too. Okay, now infants should be in rear-facing car seats until the age of 1 and a weight of about 20 pounds. So we know that, right? Common sense. Now, now here's the deal, folks. Children seated in the rear, the risk of death is greater than 1/3, okay, in vehicles with airbags, and almost 50% in vehicles with passenger airbags, which prevents we may prevent about 4 to 5 deaths per 10. That's a lot of kids. You're saving their life just by simply doing this, putting them in the back seat. But what do kids? They want to fuss and complain. They want to be in that front seat, right? They want to be in that front seat. But you know what? If you get in an accident and your child's dead, okay, what's the point then? My front office receptionist had to leave this morning early because her two beautiful, she's got these beautiful little girls, and they just got into a head-on collision this morning with the mother-in-law. And apparently it's not too serious. Okay, as far as having to go to the hospital and all that, but we're going to have to check the child's spine and get them corrected, obviously, but they're not, nothing's broken. That's the only people get in wrecks and they say, they're okay, nothing's broken, as if that means you're fine, and it doesn't mean you're fine, right? Actually, my son, when he was a junior in high school, he had that great game against New Brockton. He had a 76-yard touchdown catch, a 98-yard kickoff return for a touchdown, and he had a 3-yard touchdown run all in the first half, and had all this great game. The next game, he gets a severe high ankle sprain. Okay, when he went to Southern Bone and Joint, they said he'd been better off if he broke his ankle than to get a severe high ankle sprain. You realize that? So really, we talk about broken bones are the worst thing in the world. Sometimes that's not that big a deal. It depends what you break and where, right? So my point is, put these darn kids in the back seat. Now, children are 10 to 20% less likely to die if they're in the rear center. Okay, so like the kids here, this here is the safest position, obviously, because, side impacts and things of that nature, right? Obvious stuff. Safety guidelines, the government safety guidelines, believe it or not, state that children age 12 or younger should be in the back seat. Now, that's a tough sell to your 12-year-old, isn't it? And I tell patients, listen, try to shoot for double digits. If you at least shoot for 10, I think that's reasonable. I think an 8, 9-year-old kid has no business in the front seat, period. End of story. No discussion. No argument. Just he's in the back seat, period. I don't care how upset he is. I don't care what his friends' parents are saying. That's just the way it is. Their safety. We're parents. We're adults. We're supposed to protect these children. And then, of course, booster seats are very important. And until the age of 8 to 12, except for, if a child's tall, is 4'9", then they're ready to be put into a regular seatbelt. Now, this is my son, he turns 14 today. This is Cameron. He turns 14, and here's when he's a lot younger, obviously, and he's in a booster seat that's built into that Volvo. Okay, studies show that the use of belt positioning booster seats lowers the risk of injury to children by 60%. So these are significant numbers here, folks. Okay, now they got these gadgets here because, if you don't have something like that, that seatbelt's going to be up there on their throat, right? And that's not a good thing. Here's another little thing for this little girl. I had a patient years ago. The little boy, gosh, he was a little boy. He's a little toddler. And Grandma, he's in Mississippi, okay, whatever that means. He's in Mississippi, and Grandma throws him in the front seat. A little tiny, tiny little toddler, okay? Puts him in the seatbelt. Okay, as if the seatbelt's even designed for a toddler, and is not, okay? And she goes and hits a telephone pole. And guess what happens to his pelvis? He cracks his pelvis because it's not designed to protect the toddler, okay? So that's a bad thing. So anyway, like I said, trying to entertain you.
Are you not entertained? Are you not entertained?
All right, so let's try to entertain you because a lot of you guys, who likes motorcycles? Who's into motorcycles? It's big here in the South. Okay, motorcycles are cool. It's all about freedom out on the road and feeling like you're flying. But let's talk about the seriousness of it. We got more than 4 million of these things on the roads, but 5% of all highway fatalities involve motorcycles. But only 2% of all registered vehicles are motorcycles. So obviously they're disproportionate as far as how they're represented in fatal accidents here. But why do people want to go ahead and ride motorcycles? Okay, if they're so risky, right? Well, because can you turn the volume up? Because motorcycles are just fun, right? They're just a lot of fun. So I think maybe this will reveal that. that the kind of motorcycle you ride? Is that your ride? Yeah, that's you right there, huh? Okay, about 20% of all reported automobile accidents involve injury or death. That figure is 80% from motorcycle crashes, okay? The risk of dying in a motorcycle crash is 16 times that of dying in a car crash. But I'm not saying don't ride motorcycles. I'm not saying that. I'm just saying it's risky. So what do you got to do? You got to wear a helmet, right? You got to wear a helmet. The National Highway Traffic Safety Administration talks about 4,600 motorcyclists were killed and 81,000 were injured in 1 year. But helmets saved the lives of 1,600 riders in 2011, and 703 more lives in all states could have been saved if all motorcyclists had worn helmets. So you say, well, we're only talking about 703 lives out of millions of people. Well, listen, I mean, that's your son, that's your daughter, that's your dad, that's your uncle. I mean, lives mean something, and so it's important to wear helmets and also other stuff. You can't be riding a motorcycle like that, right? You got to protect your body. So it's not just about helmets. But if you don't want to wear a helmet, okay, so be it. Go ahead and ride down the road like this and be a future organ donor. Contribute to society. But, in 2011, 59% of fatally injured riders were not wearing a helmet in states without all-rider helmet laws. Now listen to this, folks. Compared to only 9% of fatally injured motorcycle riders in states where they had the law. Okay? I know a lot of times we get bogged down with our rights and laws and infringing on everything, but government sometimes just makes us do things that are just right for us, okay? When it comes to saving our lives. But what's a state? At least when I'm from Florida. I grew up in Central Florida, so I can diss on my state here. But when I grew up, and as far as I'm concerned, unless the law has changed, Florida is one of those states that doesn't have a helmet law, right? Has that been changed recently? I don't know. So, when I grew up in Florida, we looked at Alabama as backwards. I mean, really. And I went to school in Atlanta, and just never thought I would live in Alabama. Never. I had this impression of Alabama, and actually I like living in Alabama more than I do Florida, actually. I've been here since 1991, actually. But, you want to talk about who's backwards, that's all these Floridians here, right? All these Gator fans here that are riding around these motorcycles without a helmet. That's pretty backwards. But we shouldn't be talking about the Gators. We should be talking about Florida State, the #1 ranked team in the country. So that's the one thing that hasn't changed since I've been in Alabama. I haven't become an Alabama or Auburn fan. I'm still a Florida State fan. But this is a nice segue into our next discussion about perception and relative risk. We're going to talk about football. Who likes football in here? We're going to be watching some football tomorrow, probably? Yeah? Okay. Well, ask this question. Is football too dangerous? That's been debated. Okay. The media really says is the sport it's going to be like boxing. When I grew up, boxing was a big deal. I boxed when I was a teenager. Okay. Boxing was a big deal. Now you don't really hear about or see it that much unless you're an avid fan, because part of that's been perception of the barbarianism of it and just the head injuries and whatnot. What happened to Muhammad Ali didn't really help. But is that going to happen to football? Well, right now it's by far, and there's not even a close second, it's the most popular sport in our country. It's surpassed baseball by leaps and bounds. But football's dangerous, and this pretty much shows it.
Mike, come on!
Mike, what's your deal, man?
Come on, man. You've been riding me all day.
Mike, you're playing like Betty White out there.
That's not what your girlfriend said.
Jamie! Eat a Snickers. Better?
That hurt. You're not you when you're hungry.
So see, football's dangerous. Football's dangerous. I played. Matter of fact, my old high school football coach was in the office the other day, and I played for a coach who's in the Hall of Fame now. Actually had a college scholarship, but because I injured my neck really severely, that and the fact that I had to go out Midwest to play caused me to take an academic scholarship instead. But anyway, we know that less than 1 out of every 200,000 football players has the potential of having a cervical spinal cord injury with incomplete recovery. Okay? But compare it to over 100,000 trampoline injuries every year. And actually, in 1990, there were 6 deaths from kids jumping on trampolines. Okay? You're going to see as I go through this, boys particularly are going to get hurt. No matter if they play football, they play soccer, just boys are going to get hurt. They're going to break stuff. You know why? Something called testosterone. It flows through your blood, and you, as you're a kid, as you're a teenager, and as you're a grown man, it causes you sometimes to make bad decisions in life. It's called testosterone, okay? And so boys have a disadvantage. Okay, the National Federation of High School Association there's over 1 million athletes playing football in high school. Now, they said here that 1 out of every 100,000 high school football players will sustain a life-threatening injury or potentially even die as a result of playing high school football. Okay, 1 out of every 100,000. Okay, the Insurance Institute, Highway Safety, let's compare that. Shows that 44 out of every 100,000 licensed teenagers are involved in motor vehicle fatalities each year. Okay, it breaks down to 1 out of every 2,500. Okay, will die in a wreck. So we talked about playing high school football. 1 in 100,000 may not die, but could have a serious injury or die. It's kind of combined. But here, 44 out of 100,000 will die by driving a vehicle. And they say, well, of course, teenagers got to drive a car, right? So it's different. You don't have to play football. But still, the risk is much higher. That's why I say, the most dangerous thing a teenage boy can do is not play high school football, is running the roads with his friends after school. That's the most dangerous thing a teenager can do. The Institutes of Sports Medicine, this study here showed that children 5 to 15, there's 12% fewer injuries per capita playing football compared to soccer. 12% fewer injuries. So I've coached football from Pee-wee on up to varsity high school. This first year I've not coached football. I'm not coaching high school football anymore. It's insane running a practice and coaching varsity high school football. It's just literally it's 2 full-time jobs you're doing at the same time. But with Pee-wee football, you're not seeing these these targeting headshots and things. I mean, they're just a bunch of kids just get into a little pile here and grabbing and pulling and falling down, and they're all padded up. So it's generally quite safe. But organized football amongst little kids has 50% fewer injuries than kids riding bikes. Organized football has 74% fewer injuries than kids riding skateboards. That's dangerous stuff, them darn skateboards. Okay, again, same study here, consumer products. Football, you had 215,000 children in that age range were treated in the ER, and nearly 10,000 of those were actually hospitalized for those injuries. So still, there's a lot of kids getting hurt. But this was amazing. I couldn't believe this. Okay, they're talking about now for baseball and softball, the numbers of kids hurt. But look at this. Baseball had the highest fatality rate among sports for kids 5 to 14, with 3 to 4 children dying from baseball injuries each year. Now, this is the 2009 Consumer Product Safety Commission statistics. I don't know what in the heck these kids are dying from. I guess they're getting hit with the head of the baseball or a bat. I mean, I've been hit in the face with a baseball bat when I was a kid. But wow, that's amazing. I don't think that's consistent. I don't think you'll see that over time to be consistent. I think that's probably just an outlier, But still, I mean, kids can get hurt doing that too. We don't have time to show this. I'm not going to show it. But anybody seen George Carlin's, he compares football to baseball? It's hilarious. I mean, it's worth going on YouTube and watching it. It's really funny. But let's keep talking about the injuries here. 12 high school and college players die every year from playing football. Okay, now what is this? I threw this up here for this reason here. What most of them die from is not concussions or hits. It's heart and heat-related injuries. These college players and high school players die from heart and heat-related issues twice as common as they do from head injuries. Okay, and it amazes me because, I just turned 47, and where I grew up in Central Florida, it's hot as heck. And we had air conditioning for the most part, but you didn't have air conditioning everywhere you went. A lot of people, all your friends had cars that didn't have air conditioning in Florida, right? You roll down the window. You know, this right here, you know, people don't know what that means. When I grew up, you go up, pull up next to a girl, right? And you do this thing right here, and now they think you're nuts if you do that. Well, of course, I'm not doing it anymore, okay? But I'm saying if I was a teenager, they think you're crazy. But you know, I think it's just that these kids are just not acclimated to the heat, because I'm telling you, it's not just the schools I coached for. Kids get access to water all the time. They get to drink as much that we didn't. We'd get 1 cup if we're lucky, you know? Yes. Yeah. That's true. Got to start earlier now because there's so many games. Yeah. Well, school started later, too. School didn't start. You started school in September, right? First part of September. Now you start middle of August or something. Yeah. That probably has something to do with it. It really does. Yeah. Sure. Well, there has been talk of that, actually, of starting season. And also baseball. Baseball starts too early. Baseball, they're freezing to death out there at the beginning of the season. It's ridiculous. Yeah, so there's some simple solutions, and I think, yeah. Well, and, you know, increasing the playoffs in high school football, but the state association makes more money by having more teams in the playoffs, too. But anyway, football is dangerous. There's no question about that. Here's my point. Last point as we transition to something else, is that right now, how many of you here believe that football is the most dangerous it's ever been? Because players are bigger, stronger, faster, and it's the most violent. It's at its worst. Who played high school football in here? Okay, you know, when you played, I mean, you didn't see 300-pound linemen, right? I mean, that was a freak if you saw something like that. You didn't see guys as big. So the impression is that, you know, these guys are so big and strong and they're so fast now. They're so dangerous. But is that true? Is that just the media what does the media do with car accidents, right? They think it's all accident neurosis or litigation neurosis, trying to get money. They've sold it to the public, you know, because there's powerful entities that have really put a lot of money into getting this perception into the public. So let's talk about the perception of football and how dangerous it is now compared to when it's like when we played, a bunch of little guys running around, right? No, there was big, strong, fast guys back then too, right? I think you got more fat on guys nowadays. You didn't have bellies on guys back then, not like they got now. Look at Alabama's linemen, they're big fat guys. Okay, now 1905, President Roosevelt. He intervened. You know, President Roosevelt was going to outlaw football in the United States? He was going to outlaw it. You know why? Because people were dropping dead like flies, left and right. In one Saturday afternoon, 3 people died. 3 players died. In 2012, only 2 died in the entire season. But look at this here. In 1968, I was barely 1 year old. In 1968, 36 football players died from collisions. So not heat-related stuff. They actually died from getting hit. Okay? 36. And then here, the rough sport, this is from the Los Angeles Times, of course, and the rough sport, which could boast just 2 seasons of single-digit contact deaths between 1931 and 1977. Meaning, every year there was double digits guys dying, okay, back in those days. But since 1977, there's only been 1 season of double-digit collision deaths, okay? In the last decade of total fatalities, they're average about 3.7 per year, which is about 1/10 of what happened in the 60s, and especially that 1 year in 1968. And football hits over the last decade is 1/6 the number as occurred in the 60s, and 1/4 of the number of players that died in the 70s, and 1/2 of the number of players that died in the 80s. Okay? Here's a chart that kind of shows Sandlot football, high school, college, and pro and semi-pro, how many players died as a result during each era. And you can see the sport is much safer compared to the olden days. Okay, and there's a lot of reasons for that. Okay, who's heard this here? NFL football players die in their 50s on average. They die earlier than an average person. I've heard this so many times, and folks, it's just not true. It's just not true. Okay, the NFL concussions are actually getting better. They dropped from 270 in 2010 all the way down to 170 in 2012. And this study here looked at players that played from 1959 to 1988 and showed that 10% of the group had died compared to the expected rate of 18% in the normal population. So NFL football players die at a lower rate than the average man. NIOSH concluded that NFL retirees experience significantly decreased mortality. But this is what's happening. Okay? Listen, I've played it, I've coached it. I get tired of hearing people complaining about the rule changes in the game. They have to change the game. They had to, because you're going to lose the game. You got to get this out of the game. Headshots, targeting, there's no place for it. There's no place for it. It's unnecessary. I know this gladiator society we have, we like to see the blood and guts and the hitting and all that stuff, but it's because we're not getting hit. I've been knocked down on a football. I've been ear-holed on a kickoff. I know what it feels like. It don't feel good, and it's just not necessary. That's why concussions are going down. It's because the rule changes, which are a good thing, folks. So quit complaining about it. You steal a lot. There's plenty of violence in football without seeing guys hitting other guys in the head. You don't need that crap. Okay, here's 1994 study on NFL mortality. Just to cut to the chase, even back in the 90s, they showed here that the death rate amongst NFL football players is significantly less than the average man. Now, there is an increased risk in heart disease in linemen because they're so big and overweight, but there's no increased risk in cancer and also no increased risk of violence and other accidents. Okay. Now, what about suicide? Suicide. Forbes magazine. There was an author here that wrote in the New York Times the oft-repeated statistic that NFL football players commit suicide 6 times more than the normal rate of the average man. Okay, and this has been told and retold, and we get this spun in the media here repeatedly. NIOSH researchers found, though, that if that was the case, they should have found 131 suicides of NFL players if it was 6 times the normal rate of suicide in society. Okay? They would have found 22 if the new... Okay, yeah. There should have been 22 suicides if merely NFL players killed themselves at the normal rate that we have. But how many did they find? 9. Only 9. So NFL football players kill themselves at a much lower rate than the average man in society. So as I end here with football talk, for some of you, I'm not convinced that football is bad. It's like Mama says that foosball is bad.
Bunch of overgrown monsters manhandling each other. Remember that man wanted you to play foosball, Bobby?
Let's talk about Bobby playing football.
I don't like it, Mr. Coach Klein. I don't like it one bit. You see, my boy is too delicate to be playing foosball or whatever you call it with them gargantuans.
Foosball?
You playing the foosball behind my back? School? You going to school? Ah! Gallivan with your fancy foosball friends at school?
Even Mama can have a change of heart.
You go play foosball with your friends. Foosball's not for the devil. It's for my Bobby.
Time to open up some wood.
All right, now, why am I in the football? Well, it really comes down to the pros and cons, okay? The positives that I got out of playing football, of course, I play for a great coach, and how it's benefited me in life, I think, is worth the risk. Thank goodness we got smarter coaches. They're coaching the game differently, okay? And we got rules that are making it safer for these kids because it's not worth dying over. And I played against a kid my senior year in high school that died in a game from a head injury. But it wouldn't have happened in this day and age because that boy kept being put back into the game. It was on the other team. And that would have never happened, okay? It shouldn't happen ever now. that boy should be alive right now. So we've gotten smarter about it. But also, too, is because of my Viking heritage. Because my father is Norwegian. So I'm half Viking, but my mother is Brazilian, so I'm also half headhunter. So I'm Viking headhunter, so I guess you got to play football, right? But I was born in New Jersey. So I'm a kind of a Jersey boy, right? But then when we moved from New Jersey, my parents moved me to Southwest Tennessee, the same town, Beaufort-Pusser. Remember Walking Tall? I lived in the same town. I moved there the year Buford died, and my next door neighbor was my Aunt Trellis. She wasn't my aunt, but I called her Aunt Trellis. She was his girlfriend. She was Buford's girlfriend after his wife got murdered, So I'd stay at her house all the time, and she would show me the pictures of Buford and tell me the stories and take me we'd go to the gravesite of Buford's gravesite. And so I went from New Jersey to the Hillbilly, because if anybody's been to McNairy County, Tennessee, it's a little different than New Jersey. But anyway, yeah, I lived in Lake Apatcong and Little Falls and Montclair and all that. So, yeah. Okay, now I spoke actually this time last week on Friday. I was speaking at a conference in New Orleans, so a little different venue. And tonight I'll be going to the Dothan Northview football game. I won't be going in the Bourbon Street and French Quarter. It'll be a little different venue too. But the week before I was speaking in Atlanta, and this doctor here, Dr. Scott Rosa, was there, and a friend of mine, he practices in New York, and his patient is Jim McMahon. I got to see Jim's MRIs, but basically this was in a newspaper article here, and it has to do with Jim McMahon. Of course, he's been a poster child for concussions and the long-term injuries these players legitimately received. And again, playing football in the 70s and 80s and the way they were treated, even into the 90s, was terrible. And thank goodness they're changing that. But I wanted to pull this here. I do a very specific type of chiropractic. We don't twist or pop the neck or back. It's a very specific, gentle instruments and different ways we can set the vertebrae, because what we're trying to do is correct the spine. Okay? We're not trying to treat the spine, because really, it's like I tell patients, I'm not the one doing the healing. Your body's got to heal itself. But I've got to make a correction, and then your body takes over. If it's about me, then I've got to be doing something to you all the time. And that's not feasible, right? So Dr. Rosa does the same work that I do. And Jim McMahon went to him, and he's talking about here, this is Jim McMahon's word, I feel great now. I have friends that have killed themselves, and I can see why they did. There were times I was in so much pain I wanted to kill myself. If I had a gun, I may have killed myself. My head is much more clear, but the biggest difference is physically I feel much better. And he talks about the diagnosis of the chiropractor, and he says, it felt like a toilet flushed in my head, and I felt better immediately. And that has to do with when he got his atlas vertebrae set in place properly under the base of his skull. This is a study here that we published here about 2.5 years ago in a medical journal, and it's I'm showing here I got about just over 10 minutes left, about 12 minutes left here. This is a study, and I'm just going to kind of just tell you real quick about it. It was a large study. It was over about 1,100 cases in the study. Now, there's a lot of doctors involved, but what we purposely did is no matter what the patient's problem is, we only corrected the alignment of the head and neck. We didn't touch the back. We normally do, but in this study, we were restricted to one thing. 75% of these cases had chronic pain. So they're tough cases. They had suffered for several months or several years. Now, after an average of 17 days of treatment, not 17 days of being treated, but 17 days over a period of time. So they were seeing an average of 4.5 visits and adjusted 2.5 times over that period of time. We basically had an improvement in neck pain, depending on how you scored it, from 47 to 57%, headaches reduced by about 63%. Middle back pain improved by about 59%, and lower back pain reduced by 57%, even though we never touched the back, okay? And but these are chronic cases. These are people that have suffered for many, many years. There's reasons why you can correct the back by correcting the alignment of the head and neck, which we're not going to get into. There's no serious adverse effects. But here's a really neat thing. The patient's self-reported satisfaction was rated at 9.1 on a 10 scale. So it means they're very happy with their care. That's, in research circles, usually in really positive studies, you see like 7 point something, typically. So 9.1 is like hitting it out of the park. But really what we do with this type of work is we realign the atlas and setting the atlas so we get it lined up in relationship to the skull. Okay? Initially, in the vast majority of cases, it's some type of trauma. Okay? Now, it could be when you're a child. I mean, we have children get out of alignment sometimes too. But typically, that's why car accidents are probably the #1 cause of it. But there's other types of causes as well. But it's all about, if you want to be as healthy as you possibly can, you have to have this part of your spine right. It's just the way it is. This is my most recent textbook. Say recent, it was published in 2007. It's published by Lippincott Williams Wilkins, which is one of the top 2 largest medical publishers in the world. And this is my first textbook. This is really the review of over 1,200 studies and books on the topic of cervical care. And this book here is actually the how-to of how to do this type of work. Okay, chiropractic management for whiplash cases. Let's just briefly talk about 2 cases here. Now, we're going to talk about 2 studies, one in the journal Injury and one in the Journal of Orthopedic Medicine. So this is not the the National Enquirer. These are heavyweight medical journals. The Woodward study looked at 28 patients who had whiplash injuries who previously failed to respond under medical care. So they're chronic whiplash cases. The results revealed that these patients were now seen by a chiropractor, and they achieved 93% of the patients improved while under the chiropractic care. In the CON study, the patients had an average of 19 adjustments over a period of about 4 months, okay, which is probably a good average PI case, right? About 4 months of care. And they got 74% improvement under chiropractic care. So listen, I'm going to talk, this is another study. This is a study in a medical journal on the technique that I do, and also got really good results. So, listen, in our society, we're brainwashed to think that health comes from the outside in. That if you got a problem, there's a pill out there for it, right? You're a sucker because you watch TV and you watch these commercials and you buy into it. Thank goodness that there's drugs out there that can save your life or improve the quality of your life, that do legitimate things that you need. But it's like taking something good and just overdoing it. And that's not a good thing, folks. Believe me, I wish there was a pill you could take that would take away all my problem cases. Okay? But it's just not so. It's not about just popping pills for everything. But again, a lot of people just think that pills are good. Pills are good. But no, I don't think pills are good. And about throwing stuff in your belly, all the time.
Come here, I'm gonna eat you! I'm bigger than you, I'm higher in the food chain! Get in my belly!
What that's got to do with what I'm talking about, I have no idea. I just like it. I just like that. Okay, now, for what the remaining time I got, let's talk a little bit about some important things to glean from a doctor's records here with my last 6 minutes here. X-ray digitization. Okay, loss of motion segment integrity. What is this? This is looking for ligament damage, objective way of assessing ligament damage in a patient's neck. Okay? Now, this is done by taking flexion and extension x-rays. Okay? Because what we're looking at here is a slippage. Let me show you the diagram here. This is from the AMA Guides to Permanent Evaluation of Impairment. Now, this is the 4th edition. Of course, I know there's a 5th edition. But basically what you're looking at here is when the patient flexed her neck forward and back, is there a slippage of the joints because there's been a disruption in the integrity of the ligaments that stabilizes everything. So why is this a big deal? Well, it's a big deal because it's considered to be a rateable impairment from 25 to 28%. That's very significant. So when I check this in my patients and we find it, we had a patient the other day it was clean. We didn't have it in her case. But when we do have a case, we want to assess it. Okay, we take care of the patient. When we go to release them, before we turn the records over to the attorney, we're going to do it again. And we're going to see if it healed. If it does, great. That's what we want. But if it doesn't, then that's where, when we send the records to you, it's important you know this, because this is information that you need to know when you're negotiating with an adjuster. This is a rateable impairment, meaning this is going to cause them problems for their future health. This is a big deal. Now, I don't get into the money part. That's not what I do, obviously. But this is ammo that attorneys need, not because it's a game, because it's real, it's legit. And we don't have time to go into the studies that show all this. Here's a patient here. We digitize our x-rays with a program. It's a $25,000 program that we're able to do this objectively. But here's the patient's measurements before. See, here's at C2, see it's 13.3. That's over 11 degrees. And then here we got one at 12.4. That's also positive. Ligament damage at C2 and C6. Now here, after care, when we went to release them, C2 healed up, but C6 didn't. Okay? And then there's another way of looking at this, and that is the range of motion of each joint. Here we can actually measure how much each joint moves compared to what's considered normal, and you get percentages of normal here. So here's before and here's after, and you can see a significant improvement in the motion of the joints here. Show this here real quick. This is a 3D image here showing this is normal. It's how the joint should move. All right, now here is abnormal. This is what it looks like. Look at the joints right there. See how they're stuck? Now, of course, we've got a nice three-dimensional image here showing this here, but that's what these x-rays and the data off the x-rays is actually showing. Fractures. Okay? All right, here's a patient of mine. Here, when we look at the lateral view, it doesn't reveal something, but when we put them in flexion and extension, the lights need to be turned down, but you can actually see a fracture, a Clay Shoveler's fracture here that we wouldn't normally be able to see if we just took a lateral view. So anyway, here's a case I published in a journal of a patient that came in with an axis odontoid fracture. This right here. The patient, we took a flexion view. You can't see it because of the lights here, but that is broken right there. Here's a CT. See the fracture? This is a hangman's fracture. See right there? That's the patient. He's been walking around like this since, guess what? 1958. He got thrown through the windshield of a car and fractured his jaw, and he says that they said at the hospital they think I might have broke my neck, but they weren't sure, so I never went back. So I said, he came to me with a back injury. He didn't have a neck hurt injury. But he says, you know, I've never been in a car accident since then. I've never had a bad fall, nothing. So he's lucky. So now it was a big, I don't have time to go into the story, but it was an ordeal to try to get him to a neurosurgeon. I sent him to the VA, and they did this here, and they pushed on his neck, and they said, oh, you're so old, don't worry about it. Can you imagine? Well, finally, I got him to a neurosurgeon like 6 months later, and the surgeon put a hard collar on his neck and said, if you just even get rear-ended, a light rear-end, you could be paralyzed. That's how unstable it was. And, of course, they did a fusion, and the patient did great. But, again, these are important things to discover. All right, quickly here, negative prognostic factors that we find that are important to glean from records, okay? In other words, stuff that we find when we do a history and an examination with a patient that studies have shown is going to have a negative impact on their future health if they've been in a car accident. Okay, now, here out of orthopedic clinics in North America, they talk about a sharp, irregular reversal of the curve and osteophytes. What's that? That's pre-existing arthritis. Okay? Here's a patient here. This is a before and after x-ray here. And here, what we've done is we've morphed the two x-rays together to show the change that occurred. Skip that. See if this one will work. Ah, shoot. Anyway, it's some really neat changes here. We don't have time to show it anyway. Okay, see that change right there? What you're looking at is two x-rays that have been morphed together. It's a before and after. But what you're able to see is the amount of change that takes place under care. Because as I just showed you, the studies showed that pre-existing patients with reversed necks curves in their necks have a really negative impact on their future if they've been in a car accident. Pre-existing arthritis. Do we need to hide from that? Do we need to hide that in our records? Let's not let the insurance adjuster see that they got a pre-existing problem? Absolutely not. First of all, you got to tell the truth, right? Okay? But like I said, the truth will set you free. Well, listen, truth here is that if they've got pre-existing arthritis in their neck, we know they're going to get hurt worse. They're going to have a much more likely result of having long-term problems from this motor vehicle trauma, if that's the case here. And that's what this is. This old paper talks about. And here's a real old one, or here's another 1989. But this is interesting. Follow-up X-rays taken an average of 7 years after a motor vehicle injury, okay, showed that prior X-ray evidence of disc disease indicated 39% had developed degenerative disc disease. It was also pointed out that the available evidence indicated an expected incidence of only 6% change. So in other words, if they've had an accident, that it really significantly increased their chance of developing arthritis. And that's what this is pretty much going on. It talks about an average of 7 years, 39% residual symptoms, and new degenerative change occurring at another level in 55% of the cases. Okay? Let me see, zip through this here. Okay, another increased risk factor is women. Okay, women between ages of 40 and 49 and wearing a seatbelt were significant risk factors for whiplash injuries. And rear end impact, obviously, larger vehicle, striking, blah, blah, blah. Women got hurt, what? Twice the rate as compared to males. Stenosis. Stenosis is the opening of the spinal canal, how small it is, okay? If you've got a small neural canal, you're going to be hurt worse in a wreck. And that's a congenital thing. Someone is walking around with that. So obviously it's pre-existing, but it's something that if you find it on the X-rays, it needs to be documented in the doctor's file because it may help to explain this patient's chronic symptoms. Upright MRIs. Really, I want to zip through this. Just show you, in case you ever get an MRI on a patient and you notice they've been to like Tallahassee or Birmingham or Atlanta's upright MRI center, there's a reason for that. Studies have shown that you have a 27% error in missing disc injuries when you're taking a recumbent scan where you're just laying on your back. So when the patient's sitting and they're loading their spine and they can be put in a flex position, you have an increased likelihood of finding the injury than just a laying down MRI. Okay? So let's see if I can see some. Okay, I'll throw this at you. We know that if we did MRIs on everybody in Dothan who has no back pain, okay, about 20 to 50% of them, we would find some degree of disc damage, okay, whether it's severe bulging, maybe herniated discs or whatnot, and they have no symptoms. So sometimes you'll have an adjuster tell you, hey, so what, do they have a ruptured disc or a bulged disc? Well, that could be normal, okay, they could have had it and didn't know it. Well, we know in this study here in the Journal of Neurosurgery that they looked at 108 asymptomatic patients who had positive myelograms for disc damage, herniated discs, and had no symptoms. But they followed them for 3 years, and 64% of them developed symptoms. So just because at this point in time a patient has no symptoms, they have a ruptured disc, doesn't mean it's normal. It doesn't mean that it's okay, because in time it's going to come back to bite you. So if that is in the patient's file, it is important. Okay? This is a case I published in an Index Medicus journal. A patient that had 2 ruptured discs in his neck, and he recovered in 3 weeks. He was out of work a year, incapacitated. Couldn't do anything for a year. In 3 weeks, he was normal. And last thing I'll show you here, this is a paper I published in 2007 on these filters. These are lead-full filters I use when I take my x-rays. Long story short, I've used these my entire career, but I had a physicist from the Alabama Department of Public Health in Montgomery came to my office, and he tested these filters. And he found that the 3 x-rays I take of the neck, the filters reduced overall radiation from 65% to 78 to 75%. Reason why I tell you this is because he did this free of charge for me. He spent the whole afternoon doing collecting the data. Because his mother, about 9 years ago, who lives in Troy, came to me with 4 ruptured discs in her neck. 4 of them. And I even told her up front, I didn't know if I could help her because she's supposed to have surgery. But I said we could try. And it was just one of those rare, lucky cases that over 9 years, I can tell you, I count on one hand how many times she's come into my office with a significant complaint in 9 years. She usually just comes in the office just to give me a hug and kiss me and put lipstick on me. She's about 70 years old, guys. Don't be thinking anything of me. So anyway, so I think I'll go ahead and end it right there. Any of you have questions? I know we need to wrap it up.